All right, now we're going to talk about clinical assessments, all right? There's kind of two parts to it. One is the clinical assessment as just something you should do. The other part is the clinical assessment statement, which becomes something that should be written in the documentation of your transport, okay? They are the same thing. One is just merely something you devise and act upon, and the other part is something that becomes part of the medical record, all right? The reason that I harp on this over and over and over again is that any treatment, any intervention that is done should only be done on the basis of your clinical assessment of your patient's physiologic status, okay? If you aren't making clinical assessments, then your interventions are not sound. You don't have anything really to base them upon, and you're just knee-jerking, all right? So we do this every day. It's just a little bit different way of thinking about it and realizing what you're doing, and to make it, again, an active process, something that you are treating for specific physiologic reasons. And, you know, why on earth am I giving albuterol? Why am I giving a 10 or 20 per kilo bolus? Why am I bag valve masking and asking my partner to hand me an ET tube, okay? So it's getting you to focus and formulate and being able to verbalize and communicate that with other care takers, especially your physician counterparts, whether they be the outside physicians at the outside facility or your medical control physician at your own facility, okay? It is something that we do in medicine, no matter what level you are at. You know, it doesn't matter what your specific degree or, you know, role is. We should all be doing this to focus ourselves on proper, you know, are we responding properly, okay, to this problem? Now, the other part is if you do not have an accurate or precise or correct clinical assessment, then how good is your plan and intervention going to be? Not very good, all right? So that is why it's very important to do this. It is not a diagnosis, okay? It is not the same thing as making a diagnosis, all right? If you come upon someone in the street and they are unresponsive and they are not breathing, do you have to have a diagnosis in order to attend to them? No, okay? So I am not talking about making diagnoses. I am talking about understanding your patient's physiologic status, okay? So a clinical assessment is when you combine your knowledge, okay, and you know, obviously it could be a lengthy bit of knowledge or it could be a very minimal amount of knowledge, all right? But you combine your knowledge of the patient's history, including the history of the present illness, your physical exam, and then any objective data that you have, all right? Vital signs, lab results, x-rays, okay? And you take all of that information and you process it, all right? And that is based upon your knowledge, your experience, and your clinical acumen, all right? And you come up with a description of your patient's current physiologic condition, okay? So let me give you some examples, all right? Let's say we have an 18-month-old, and it's January the 15th, all right? They come into the emergency room. What are they going to complain of? Because what do 85% of visits to the pediatric emergency room, what's their chief complaint? Difficulty breathing, right? Okay. They come in, that's their chief complaint, and you start talking to the mom while you're looking at the child, okay? The patient has a respiratory rate of 50. Their SATs are 87 on room air. Their heart rate's 168, okay? Their retractions, they have moderate retractions. All right, you auscultate and you hear, what's the first thing I'm going to tell about a respiratory assessment? Air exchange, okay? Their air exchange is fair, okay? And you hear diffuse crackles, and they're also coarse, all right? And their mental status is, they're awake and alert, but they're certainly not playful, okay? A little irritable, all right? And mom tells you that, kids never really been significantly sick before. All they've had to do is go to their, regular checkups, never been into the emergency room. But little Johnny started kind of coughing and sneezing 3 days ago because his older sister Jenny, who's in the 2nd grade, she had it, the week before that, okay? So that's the information you have, all right? You've got the history, past history, you've got the history of present illness, you have done your physical exam, and we limited that just to the respiratory system for time's sake, all right? And you have some objective data with your vital signs, okay? So what we're going to do is put all that together and describe, all right, as succinctly and as accurately as we can what our patient's current physiologic status is, all right? So we can say this is an 18-month-old, all right, with mild hypoxia, right? I mean, we're not horribly hypoxic, but, mid to higher 80s with some mild hypoxia. And now, what is our biggest issue? We have a big change in our air exchange, okay? I mean, that's the one physical finding that we can put our hat on. Along with, what else are we seeing? We're seeing retractions, increased work of breathing, and our adventitial sounds are, some crackles and coarseness, all right? So we put all that together, and, I would say this patient is in respiratory distress, okay? Now, like we talked about and other things, we like to have things that are objective and not subjective, okay? Or at least graded on a scale. So what gives that statement even more meaning is to put a little quantifier in it, okay? In our judgment, is this patient in mild respiratory distress, in moderate respiratory distress, in severe respiratory distress, or are we going to say this patient's in respiratory failure, okay? All right, I would say that, by this description of this hypothetical child that I made up, that, this patient is in mild to moderate respiratory distress. And yes, that is fair, okay? You can be in between, all right? If your concern is that it's a little more than mild, but, you're a little hesitant, it's kind of like ordering steak, all right? Some people want it rare, absolutely rare. Some people want it well, absolutely well, all right? But most people pick, medium well, or, in between rare and medium, right? That's what we do as humans. So it's totally fair and totally appropriate to say mild to moderate respiratory distress, or let's say our patient, was worse off. All right, if we don't want to really say they're in severe respiratory distress, we can put moderate